Do you suffer from bouts of depression? Well, most people will become depressed from time to time for many different reasons. Loss of a loved one, a breakup of a relationship, or loss of a job, or any number of reasons. The problem is when depression becomes chronic, a malaise of feelings of helplessness and lack of drive. Such depression can cause the sufferer to neglect themselves and to sleep for much more longer than they should, simply waiting for the day to come and the night to begin. Those suffering from severe depression may have therapists who describe drugs such as Xanax, which still does not halt the onslaught of the crippling feeling of uselessness. However, recent research has uncovered natural ways to augment those therapies for depression, and they may serve as a panacea for those who have tried everything and found little relief from anything else. Hi, I'm Dr. Feelright, and today we will be discussing how you can treat your depression naturally. This is not to suggest that someone who is severely depressed and is on a strong regimen of antidepressants simply stop taking them, as there will be serious withdrawal repercussions for doing so. Rather, that if you are severely depressed and on medications, that these recommendations could dramatically change your mental state. If you're not clinically depressed, or you're just looking for something to bring you out of the doldrums, then these recommendations could be just what you're looking for. Both examples are natural things that we're talking about and involve no drug usage. So let's examine these methods and see if they can work for you. Scientists are generally in agreement that depression is exacerbated by a shortage of serotonin and dopamine in the brain. Now, serotonin is a chemical that creates calm and well-being, and it augments dopamine, which is the happiness and joy chemical, to give you happiness in general and contentment. Both work hand in hand for overall joy and contentment, and when the body is deficient in either or both, it is a situation which in layman's terms is called a chemical imbalance. And when people smoke marijuana, the THC, which is the active ingredient in marijuana, binds to the same receptors that use serotonin and dopamine. So while the depressed person is high, they remain depressed. And the THC is a central nervous system depressant, just like alcohol. So you're really not doing anything for yourself when you get high or drunk. And the offshoot of that is that it's just not good for depression. That's why drinking and smoking marijuana just makes the user intoxicated, but they remain sad and unfulfilled. The answer to this conundrum is to find a way to increase the feel-good chemicals in the brain naturally. Now, here's how this can be done. The recent research has found that a basic exercise that virtually anyone can do can have a beneficial and profound effect, even in severe cases of depression. That exercise is walking. Walking 45 minutes to an hour daily not only has profound health implications, but more importantly, to the depressed person, it releases feel-good chemicals called endorphins. Endorphins are the body's natural morphine. And in addition, walking reduces stress and allows the participant to focus on other things rather than the bad thoughts. It would behoove a person suffering from depression to don a pair of earbuds and their favorite walking shoes and take off for a walk for an hour, listening to a collection of upbeat songs while briskly walking for an hour or perhaps more than that. The second recommendation is one which many have indulged but could never quite figure out why it worked and why it made them feel good. People have been bringing this item to others for centuries as a token of affection, and it usually was very effective. It is chocolate. But why is it effective in quelling depression and promoting a good mood? It's because chocolate's mood-altering ingredient is phenylethylamine. Phenylethylamine is a building block for dopamine and serotonin, and is responsible for that love feeling that you have when you're in a good situation and you're enamored with the person that you have the greatest feelings for. You can get phenylethylamine from eating chocolate, but you can also get it in a supplement form. If you choose a supplement, it should be used judiciously, as there are precautions for people that have high blood pressure and it could raise it. Also, if you're on depression medications, you should consult your doctor. However, walking and simply eating more chocolate could be a situation that could be beneficial for you, and it doesn't include talking to your doctor or altering your drug regimen. Now, make sure not to confuse it with phenylethylamine, which is a precursor to tyrosine and is much less effective. If you try these strategies, it can't do anything but help your situation and make you feel better. I'm Dr. Feel Right, and I'm always doing research for anything that can help you eat right and feel right. Thanks for watching, and as always, have a great day.